Hi, everyone. Can you all hear me? Looks like it, yeah. Um, let's dive in. Thanks for joining as always. So we have 133 cases that are confirmed. As always, that number is probably not fully accurate, and we probably have more cases in New Haven, but those are the number that we have confirmed. A couple of quick updates, and then I'll hand it over to other folks on the call. So at Bella Vista, there's a total of 3 cases. All of them are in the hospital now. None of the confirmed cases are on site. Fairhaven Health has been a great team member there, and they're actually able to conduct tests in residents' rooms if they are symptomatic and merit a test. And so we're very grateful to have them on site as a trusted partner to keep people in Bella Vista safe. We've had a second firefighter test positive. We're still anxious to get the test results for the remaining firefighters and police officers, and discussed with Yale New Haven Hospital earlier today about those tests results, and they're working very hard to push Quest to get those back to us as soon as possible. And then as people may have seen, the Southern Connecticut State University facility is going to be used as a COVID-19 step-down site. So previously we had been told it's not as likely that it would be used for COVID-19 patients. We're now told that this will be a COVID-19 step-down site designed to decompress the acute care hospitals to maximize room for the acutely ill. As folks may know, a step-down unit is a way to provide intermediate care between intensive care units and general medical surgical wards. We're also getting an indication that they may actually activate this site on Friday. We'll share information as we get it with you all. I don't have any other major updates myself. Does anyone else on our team? I know Dr. Tracy had some updates. Does anyone else on the police and fire or Director Bond have any updates they'd like to add first?
I just wanted to add that we had our first infant fatality in Hartford County. It was not in our county. However, it's really important when we are talking about the recommendations in regards to reducing the risk of exposure, that the proper precautions are taking into consideration. So again, we want to emphasize the importance that this is not just affecting the elderly, this is affecting the entire community. We are in community-wide spread at the moment, and so we ask individuals to please follow the proper precautions, which is to self-isolate as much as possible. You should not be leaving your homes unless it's absolutely necessary. And if you do, please follow the proper precautions of practicing social distancing, not having prolonged exposure with individuals that may have COVID-19, or even if they are asymptomatic or not, you do not know who has COVID-19 at this juncture. As you know, there are limitations with access to testing and availability to knowing who has that information in regards to sharing who has COVID-19. We also want to make sure that you're protecting your loved ones. So if you know that someone is in self-isolation in their homes, that you ensure that others are not posed to the risk of getting COVID-19. And so please follow the precautions. And as you know, we have enforced different avenues, and this is the justification of why we have closed different parks. And we ask individuals to please not congregate, because we can increase the risk of exposure. So my condolences goes out to the family that lost their infant, and those family and friends of that family member. And so again, please practice the proper precautions. We're asking you urgently to follow the recommendations that our mayor provides each day to you. Thank you so much.
And just to clarify, that infant was not a New Haven resident.
It was a Hartford County resident.
Okay, thank you. Anything else, Chief Alston or Chief Reyes, or should we move on to the public schools? You good? Okay. Dr. Tracy? You're on mute, Dr. Tracy.
Okay. Good afternoon, everyone.
Good afternoon.
let me say that I am very thankful for the level of collaboration between the City of New Haven and the Board of Education in the work we're doing. And this is COVID relevant in the fact that because of the close down of schools, we have to quickly think on our feet and plan and provide for our students opportunity for extended learning in their homes. We have done so, and I think I want to commend my staff for the level of professionality and care that they have demonstrated in this time of crisis. It is true that crisis brings out the best and worst in us. I've seen it brought out the best in our staff, administrators, teachers, custodians, security, food service, everyone who has been working hard to make sure the needs of our families are served. It is unfortunate too that we do have on our side some reported COVID cases, and the health director has been very, very engaged in providing updates and supports to those individuals. On the other hand, I want to say that we care about all our staff members, every single one of them. We care about their health, their safety. Right now, there are concerns raised about the safety of our frontline workers, our lunch aides, our security guards in the buildings, and our custodial staff. We had a risk management meeting with our director of health, and we have some ideas of how we're going to make sure that we further protect their safety as they work in our schools. I'll now turn this over to my board chair, Ms. Yesenia Rivera, who has also been supportive of the work we're doing in the school system.
Thank you, Dr. Tracy. I just have a really quick statement that I want to share, and I prepared it ahead of time just so that I'm not sidetracked. So at this unprecedented time, we see inspiring examples of teamwork and mutual support all around us. Our school employees are doing extraordinary things to benefit the students and the families we serve. As Dr. Tracy and Mr. Pinto have shared with the board, the staff, and the public, the district is employing special measures to keep our employees safe as they do their important work on behalf of our students and families. Unfortunately, there are those who feel that not enough is being done. So I want to give you just a glimpse of what's been happening behind the scenes. So far, Chromebooks have been distributed to over 7,000 students. We've served something close to 50,000 meals to our students, and online learning activities have started. While the rollout has not been perfect, please be patient. We are living in unprecedented times, and the board, the superintendent, and her staff are working hard to work out the kinks. Public health experts and education professionals are guiding the district's work calmly and competently during this unprecedented health emergency. At this time, we all must work as a team. Alarmist comments and repeated questions by individuals only serve to divide us at a time when we should band together for the sake of our students and their families. The mayor, the superintendent, and her administration need us all united to assure that this important work is being done on behalf of the students and families and continues in a manner that is safe for all of us. Thank you.
Does anyone else on our team have anything to add before we hand it over to the press for questions? Okay, are there any questions? Mr. Breen.
Thank you, Mayor, and thank you, everyone. Mayor, I understand your office recently submitted a proposed order to the Board of Alders that would allow you to enter into agreements with indemnification clauses.
Mhm.
And I wonder if you could explain a bit the purpose of your submission of that proposed order, and if it was designed specifically for a potential relationship with the University of New Haven, or if other partners are also in mind for that order.
So this was part of our negotiations with the University of New Haven, and it's an understandable request, and I think it's generally a pretty typical request. We're asking them to house public safety employees, and they wanted us to indemnify them if there was any lawsuit related to that activity. We've spoken with the Board of Alders leadership about that, and they have very kindly agreed to expedite the process where they will vote on this request. Given that there's a lot of moving parts here and we didn't want to have to trigger an additional Board of Alders meeting should we have a similar agreement with any other entity, we asked them to allow more flexibility for us to sign another agreement with another entity should that need arise.
Is there anything more you can say about a potential agreement with UNH about how many people they might be able to shelter and about another organization that you just mentioned?
I can't say anything about any other organization, but Chief Alston or Chief Reyes, I don't have the agreement in front of me. Do you know the number of people? I'm not sure as they've agreed to a specific number of people, but we asked for 160 people. Was that it?
That's correct, Mayor. It was 150 to 170 in capacity.
Okay.
Thank you.
You're welcome.
Mayor, do you have an update on the proposed shelter for homeless people who test positive that will be a career?
My update is we're getting close. We have had an incredible response from the Medical Reserve Corps and are working to process the volunteer submissions that people have provided, and we're getting close.
And then my last question is for Superintendent Tracy. You mentioned brainstorming with the health department some ideas about how best to protect lunch aides, security guards, and custodial staff. I understand if you don't have anything set in stone right now, but is there anything more you can say about what you all are considering in order adopting to better protect those people?
Let me defer to our health director on health-related issues.
I am your health director. It's okay. So one of the things that we are doing, across different departments, and of course with the Board of Education as well, is continuously looking at protocols and processes that are in place to ensure the safety of our employees. And so the recommendations that came forth this afternoon was just really to assess a couple of things, just pre-screening individuals before they come into work, which is standardized across other departments. Also discarding in the trash and the disposal of gloves that are being used, and the frequency of the changing of PPE, personal protective equipment, that are being used. And so there were minor recommendations, but they come a long way, and they're really important. We also encouraged a standardized memo go out so that we're communicating to our employees continuously about the importance that it's okay to be home when they're sick and not feel that they have to be obligated to come to work. So just, some measures that are standard across each of the departments, that we're just sending the right message and the same message consistently.
Thank you very much. That's it for me.
Hi, Mayor. I was wondering if you could elaborate a little bit more on, in the indemnification order, you mentioned the city being able to house employees such as first responders or the homeless. And I'm wondering if you are currently in any negotiations with partners in New Haven about housing the homeless, and also if you have any updates regarding the city's request to the state to fund more hotel rooms for homeless individuals.
So my understanding, there are not too many new details from yesterday. My understanding is that we will start moving individuals that were at homeless shelters to hotels potentially tomorrow. And to your other question, I don't have any other updates about other parties in our negotiations regarding potential housing, separate housing for homeless individuals. But presuming the Board of Alders does approve this request, if we did have an agreement with another party, this request for indemnification would also be able to cover another party if that were part of our negotiation.
Thanks so much.
You're welcome. Other questions? Go ahead, Kyle.
First, a quick question. Do you have any members of the homeless community that have tested positive?
Director Bond, I don't remember if a while ago there was, at that one site, there was one or two that did. You're on mute.
Sorry. Early on, when we first started reporting our cases, there were two. And I spoke to the hospital this morning in regarding to some of the processes and flagging anyone that may be homeless. And so they have that prepared. So we have none at this time that need to be relocated that are positive cases and are homeless.
Okay. Thank you. And then the second question is for Dr. Tracy. Have there been any updates yet on how testing and the end of the school year, those sort of considerations will be made? Does that come from the state yet?
You're on mute, Dr. Tracy.
Mute, always.
Now you're
Okay,
good.
so the State Department of Education, all standardized testing are waived. Currently, there will be no standardized testing.
Can you repeat that? You kind of cut out.
There will be no standardized testing based on information from Commissioner Cardona from the state. All those are waived.
Students are celebrating.
So when you start to look at how like students with IEPs and other requirements for finishing the school year, those secondary set of requirements, have those been looked at all yet?
So we're still awaiting further state guidance, especially as we deal with the fourth marking period closure and what those will be and the impact on students who may be applying for colleges, what it may do for IEP. Normally IEP students, many of them, we cannot fail them according to special ed law. So they're well protected on the special education laws.
Okay,
Yes.
thank you.
Mhm. Tiffany Jackson, did you hear that?
I did. I heard it. I don't know if you wanted to, if there was.
Special ed director.
So I don't know if that answered the question, if there was anything else that was needed, but pretty much some of the things and the guidance that we're getting from the State Department of Education, again, things like timelines and waivers to host what we call our planning and placement team meetings have been deferred, but certainly we are, to the extent possible, making sure that we're ensuring that our students with disabilities are continuing to receive their services as such.
Any other questions? Not sure what's going on with Mary O'Leary here, but usually she has a question. It's hard to know if she's even there. Okay, other questions? Any other questions? Going once, going twice. Mackenzie raised her hand just before. There you go. Nope. There, okay. I think I was trying to unmute you at the same time that maybe Gage was or you were. So sorry about that. We were unmuting and muting each other.
No worries. Just wanted to ask a quick clarifying question on moving homeless individuals into hotel rooms. My understanding is that there isn't a place that people can go ask to be moved into a hotel room. Is that correct? Is it more the cities reaching out to individual shelters and moving people?
So the state has been in communication with the CAN, which is the Coordinated Access Network. And the CAN was developed a while back in order to have all or as many as homeless shelters as possible communicate better to track individuals and allow them to support individuals more. So the CAN would be the appropriate place for additional individuals experiencing homelessness to potentially access hotel rooms. And the point of the can is that any shelter is an access point for into the can. I think you raise a relevant question about if the homeless shelters are closed, will there be staff there so that an individual can actually find someone to get those resources? And I think that's a good question, that this is happening so quickly. I don't have a good answer for you, but I'm happy you flagged it, because we should look into that. I suspect Dr. Jalal already knows the answer to that question, but I'll check back.
All right, thanks so much. And is it still 84 individuals in hotel rooms?
That's my understanding.
All right, thank you.
I see Mary O'Leary's back. There's two Mary O'Leary's now, which is great news. Do you have any questions, Mary? I'm not even sure if we can hear you. All right, well, you've got my cell phone number. So if you have any questions, feel free to call. Thanks, everyone. Have a good one. Take care.
Thanks.